Welcome back to another episode of Built from the Inside Out. I know I have been gone for a while, so I wanted the first episode back to be something special. I've been obsessing over this topic, so I wanted to bring in a professional to answer some of my questions and help you guys also maybe answer some of the questions that you guys have at home. I want to welcome Dr. Sarah Anzola. Thank you so much for being here today.
Thank you for having me. I'm super excited to be here.
Yay. So tell us a little bit about yourself and what it is that you do.
So, I have a doctorate in acupuncture and integrative medicine, and what I specialize in is helping to empower women to support them in their health. I studied for 6 years to get my doctorate, and I even traveled to China, and I did an internship in China, which was really cool in the hospital there. And throughout that time, I really became, I fell in love with women's health. I even was a doula during my 6 years.
Really?
Yeah.
Okay.
And so I helped women through childbirth, and more importantly, I helped empower them to feel, educated and supported and understand what their bodies were about to do. And then in postpartum, I also help support them and educate them in how to take care of the baby. So that time I was a doula, it really drove me more and more into women's health. And so that was kind of like the foundation of where I am today. So now I work with a lot of women, all ages, and I help them no matter where they are in their life to understand their bodies, understand their cycles, their hormones, the connection that it has to their emotions, like what we talked about. And it includes, because it's holistic medicine, includes everything. It's the mind, body, spirit. It's not just one tier. It's all of them.
So you are perfect for this podcast.
I hope so.
Yes.
I hope so. I'm looking at your logo, and I think that it fits. Yeah.
Yeah. So I have so many questions, but we'll start with the first thing. So acupuncture, what is that, and what interested you about it that made you want to make that your career?
Yeah. I actually didn't ever really know what acupuncture was. It kind of came up on me in my undergrad. I was living in Austin. I was studying at University of Texas. I wanted to be a dentist. I had wanted to be a dentist since I was in the 5th grade. And I was actually talking about this recently about like looking into being a dentist for the military. And so I was really headstrong into knowing I always wanted to go that path. But when I was a junior at school, one of my nutrition classes really hit home, and helping me understand, mass production, what's really going on, a little bit further behind, the grocery store and what we're buying, and, looking at pesticides and chemicals and all these things, and my wheels were turning. And at the same time, my grandpa got diagnosed with cancer. So I was watching him just, literally go into the system of, okay, you have cancer, these are your options. And since then, I've had another relative go through cancer, and their options are so limited. It's either radiation or it's chemotherapy. Diet is never discussed, nutrition's never discussed, mental health. They tell you, okay, yeah, you can eat and do whatever you want. So I said, there's something not right. I need to focus more on just the mouth. I need to focus on the person. There's so many people that need that support and that guidance, and they're not getting it in the way that our medical system is structured. And so through that, I started doing a lot of research. And I started having meetings kind of like this with other professionals, and asking them, why is it that you do what you do? Do you love it? And how do you feel that you help people? I met with acupuncturists, naturopath doctors, holistic dentists, etc. And so I really narrowed it down to the fact that there was a school here in Houston. Houston was home. I wanted to come back home. I was in love. I wanted to get married. And so all of that drove me to studying acupuncture and integrative medicine. So acupuncture, what is it? It's a 6,000-year-old medicine. And it involves the insertion of tiny needles, extremely thin as a strand of hair, into different pressure points in your body. So 6,000 years old, right? It's a long time for people to observe each other. So the medicine was really built on observation and pressing different points and seeing where they're connected to in the body, and when you stimulate at certain points, like what response your body would give. So over that period of time, they developed different pathways throughout the body. You can think of it like mini highways that connect your organs to different parts of your bodies, from your hand or your finger to your chest per se. And so along these different road maps are different points, and they connect to specific organs. So whenever you're putting a needle into one of these points, it's helping to stimulate or elicit a response through that pathway or through that organ to help your body to heal itself. There's no medicine on the needle. It's natural, and it just helps your body to come back into balance in whatever we're working on, which I know we'll get into women's medicine and what that looks like. But
okay. Yeah, I was going to ask for an example because there's this girl that I follow on Instagram, and she had posted how she and her husband had been trying for a while now, and she was like, people keep asking me, and it's not that we don't want to. She just was very open and vulnerable.
Mm-hmm.
So I had messaged her because I had heard about yoni steaming, and then she was like, oh, okay, thanks. And she told me she had been doing acupuncture, but I had never heard of that. Like, for being used for that is usually, when I hear about it, I think someone got hurt in the gym or something like that.
Yeah. There's a huge rise for fertility right now with acupuncture because when it comes to fertility, you're set on a timeline, and so women and men, they feel pressured to have a baby within a certain amount of time before their time's up, right? So during this time frame and this pressure by society or by themselves, they will do anything to conceive. So acupuncture has been, trending per se over like the recent years as one of the things to do to conceive, and it is very effective because it's root cause medicine. So it's not just about helping you to get pregnant, because I'm a big believer that you can get pregnant. Anybody can get pregnant as long as there's not like, a structural problem or, a medical diagnosis that says otherwise. So it's very effective in the sense that it just helps your body to be ready, and helps improve blood circulation in the lower half of your body, and helps to rebalance hormones for men and women. And so people have seen that, hey, yeah, it's helping me to get pregnant. And so, because of the trends, then everyone is jumping on board with it. But
okay.
yeah.
So I was thinking about what you said earlier about your grandpa, and how traditional, or what would you call it, like hospitals and...
Yeah, we usually term it Western medicine, or
Okay.
allopathic medicine.
Yeah. So you said there's only so many options. What options are there on the holistic side?
So on the holistic side, if you go to any holistic provider, usually what they're going to work on is, movement, lifestyle changes, dietary changes, decreasing stress, decreasing inflammation. So it is pretty similar, as far as what will be tackled. It's just a different method or a different way that it will be tackled depending on the professional. If that answered,
Yeah, because I see a lot of on social media how they say, like the cure for cancer is out there. Like other countries are curing people. I don't know if that's true or not. You've been to China, so you tell me what your view is on that.
It was for cancer. Gosh, it's so hard. I've seen some amazing cases of people with cancer, and they overcame on their own. But it took a lot. Like for one example, I have I know a girl, and she got diagnosed with cancer, and she had first went, I guess you could say like the Western medicine route. And then she was like, you know what, I'm going to cure it myself. And she got out and she became a vegan, and I believe raw vegan even. And then she, changed her mindset. She did yoga. She went to Mexico and did ayahuasca. I mean, she really was desperate to try anything and everything to heal herself. I mean, and years later, this is 12 years ago, she did, and they told her that she never could. So I'm a big believer of, like, you can create your life. Whatever you want in life, you can have it. You just have to really put your mind to it and be willing to make those sacrifices, because it's not comfortable going through all these changes. But, and then there's on the other side where I've had patients that have been diagnosed with cancer and I've lost them. Recently, I had a 16-year-old that passed away. Okay. So is it inevitable? I don't know. But I think that at least you could try. And it's beautiful, the bliss of hope. So even if you feel, hey, I can beat this and I can do it on my own, then why not give it a try? Because you don't know if tomorrow's guaranteed either way. Yeah. So cancer is a tough one, because I've seen both. Yeah.
I don't know, that's heavy.
Yeah, I know. But I love to talk about it, because through heavy and uncomfortable topics, come breakthroughs. So,
right.
Yeah.
So you said you went and studied in China. At what point of your studies or career was that?
Yeah. So whenever I was like, the way that it is in Texas, and in every state it's different for acupuncture and integrative medicine, is I studied 4 years. I got my master's, and then I studied 2 more additional years to get my doctorates. So during that time, towards the end of my doctorates, I took a little break, and I went to China, and I studied in Tianjin, in the hospital there. And mostly they specialized in stroke rehabilitation and Bell's palsy, facial paralysis. So I was able to learn a lot of cool techniques that I still use today. I still treat Bell's palsy, strokes, facial paralysis. And I wasn't there for too long. It was about 6 weeks, but it was enough. And I'm very thankful that I had the experience, because over there the culture is so unique, and they use a lot of herbs similar to even Mexican culture, because I see it so often in the stores, using all different kinds of herbs to decrease blood pressure, balance blood sugar, decrease stress, hypertension, everything. So it's similar like that, except it's a little bit, it's how do I say this? It's more popular, I guess, more mainstream. So people seek that out. And in the hospitals there, half of the wing, half the hospital is Western medicine as we see it, but the other half of the hospital is holistic medicine, and it's so cool. I don't understand why that couldn't happen here. People go with their insurance, and they can either choose to get medicine from a pharmacy, like we know, or they can choose to get medicine from an herbal pharmacy, and they compile bags of herbs, that they cook all different kinds of herbs, and they make specialized formulas for patients there. So I wish,
really cool.
Yeah, I wish I could do it here, and I have seen people try to do it, but because it's just not so common, it's hard to be successful. Yeah.
Do you think it's because big pharma?
Big pharma, yeah. And we're programmed for instant gratification, right? We want it, and we want it now. And so when it comes to medicine, it's like, okay, you can just go pick it up and you can get it now, or everything is so instant. And when things are not instant, they seem, complicated, and they frustrate us. And so because of, how our society has become with just that, it is hard sometimes to, breed in holistic, techniques, because they're not instant. It takes time. It takes time for your body to rebalance and heal and
right.
rejuvenate itself. Yeah.
Would you say that was the biggest difference you saw over there, from the way they do things and the way we do things? Or was there something else that you were like, you brought back with you? You're like, I wish they would teach this here, or they would let me, like you said, they would let me do this here.
Yeah. I don't know. The States has and I love Texas so much. and because I'm licensed by the Texas Medical Board, I'll speak on behalf of that. Texas has really good regulations that I would never take for granted, because in China, they don't have HIPAA, so it can be like 50 people in a room hearing your problem that you're telling the doctor, and they interject and they say, "Oh yeah, like I had that last week. Oh yeah, I had that too." And and it becomes kind of chaotic. And as far as like sanitation and that kind of stuff, I'm just really thankful that how Texas is and how the states, is on like just making sure like we're protected as practitioners, we're protected as patients, and all of the formalities, behind, wearing gloves, sanitizing, cleaning with alcohol before doing anything, it just, yeah, I prefer that.
Oh, okay.
But other than that, it's just really hard to compare. Yeah.
Okay. Let's talk about women's health.
Yeah.
So a lot of people don't know that it's different from men's. So I used to compete in pageants. I used to do fitness competitions, and nobody ever talked to me about this. Nobody taught me this. And so the workouts and the meal plans that they would give me, it was very much like a man's. Like here are the steps for you to lose the body fat. And it wouldn't matter what stage of my menstrual cycle I was in. It didn't matter if I was feeling tired, like, oh, we'll push through, or drink pre-workout. And then I would feel very bad about myself if I wasn't as strong on certain, and I didn't know. I was like, why do I feel weak today? So there were certain things that I did, and you get the result, you look a certain way, but then your hormones are messed up, and there's things that you don't understand, so then you're feeling guilty about it yourself, like, is it me? Am I doing something wrong? So can you touch a little bit on that?
Yeah. So I actually, I was a dancer for a long time. I danced in college, and I weightlifted before kids. And so I have a similar experience to you. I would go to the gym, and I would tell my trainer, "Oh, I'm on my cycle. I just want to take it a little bit light. I'm cramping." And he's like, "Ugh, oh my gosh, like you can do it because you're complaining. Like do 10 more, do whatever. Like But for him, it was like good morale. Like you're struggling. I got you. Like keep going. Like do a few more." And so he didn't mean anything bad by it. He was doing good for what he knew. But when we separate the two and we are looking at women's health, it can really take a toll on your body. And I do have a lot of athletes, for patients and women in particular, because that's my specialty. And I see their hormones will tank. When we're really pumping iron, it stimulates a lot of stress response by the body, right? And this stimulates cortisol in the body, and that will also trigger pumping weights, a boost of testosterone. So whenever we're doing this throughout our cycle, it can really deplete your hormones so that you have more testosterone, and then your female hormones, estrogen, progesterone, they are decreased. And so this will lead to missed cycles, is usually what I see in women athletes. They'll miss their cycle, they won't have a bleed. And then, and if it goes on too long, then we're working at, okay, we got to bring your cycle back. And it's challenging because if I tell them, hey, is there another exercise that you'd be open to? Maybe not, lifting heavy weights, every day, throughout the month. Could you just do that maybe when you're ovulating? But going back to, culture and, wanting to look a certain way per se. I have patients that will say, "Nope, sorry. Like this is the body that I want to have, and this is what I got to do for it." So, it's tough. You feel like if you're not educated and you're not really aware, then of course, no, why would I change? This is what I want to look like. So that's why it's so important for us to, educate ourselves so that we can educate others and empower others, and so that we can, make it okay. You don't have to, as a woman, maybe look a certain way. You can practice, more self-love, more gratitude, and more acceptance some days, than other, and go for that, those Pilates or that yoga or that light walk instead of that heavy lift.
Yeah. I didn't know about this, and I recently found out, and I was like, oh my goodness. So I have an obsessive personality. So when I find something new that I'm interested, I'm like, I go all in. So I was doing research, and you tell me if I'm right or wrong, but I found that there are 4 phases, right? So you have the menstrual phase, you have the follicular phase, ovulatory, and then you have the luteal phase.
Mm-hmm.
And during the menstrual phase, they tell you, take it light, maybe don't work out for the first few days, go on a walk, do yoga, Pilates, and then follicular phase, you feel more energized. This is the time for you to do HIIT because you have more energy, ovulatory, lifting weights, and then luteal phase are like, you start to bring it back down again.
Yeah.
And to me, that was like mind-blowing. I was like, what?
Yeah. I didn't know any of this, right, before when I was younger either. And so it's something that I've learned, over the years studying this medicine and really practicing it. And so it's crazy. And I don't know if you have, but I've definitely, really integrated those specific workouts and depending where I am in my cycle. And it makes a difference, because when you are, in your luteal phase or you're about to bleed or you're bleeding, you just feel like, a little foggy headed, out of it, and heavy and tired. And so that gentle movement is really restorative, and it's just a beautiful way to provide like self-care, instead of like and I feel like probably almost every woman, maybe we don't talk about it, feels that way, right? Like if you're lifting weights and you're like bleeding, you're cycle day 1, cycle day 2, like it just doesn't feel good, It doesn't, you don't feel like restored or refreshed afterwards. You're just like, you're struggling to get through it. So that's where like being mindful really plays, in taking care of your health, like doing some check-ins, like, well, how do I feel today? How does my body feel? How does my mind feel? And then really picking movement based on where you are that day, versus expectations of where we need to be in comparison to others.
Right. So. Yeah, I think I still struggle a little bit with that because I did weights for so long, nothing else, just weights. And I would hate okay. There's days when I still skip it, but it's something I'm still working on because in my mind, I'm like, I have to lift this heavy or this amount. And then on the days when I don't feel strong enough, I'm like, remember, you're in that phase. It's okay. So I have to like talk to myself and be like, hey, stop.
Yeah. I don't think, I like to look at the glass as half full, and I don't think there's anything wrong with that. It sounds like you're very driven, you're a high achiever, and you set a lot of high expectations for yourself. That's why you are where you are, and we're doing this podcast. So I think there's a lot of beauty to that you should give yourself credit for.
Thank you.
But yeah, then, some days, we don't have to be so hard on ourselves and be like, it is okay to just like breathe. It's okay,
Yeah.
And not put so many, expectations on herself. So.
Yeah. Yeah, I actually did try yoga with Nati. She talked me into doing a class last month. I was on my luteal phase, and then I got my period the next day.
Oh, nice.
And in my head, I was like, it's not your fault. Nah. Yeah, but I'm like trying to open my mind to other things other than weightlifting.
Yeah. You'll get there because I was there too. And like there's so many different types of movement. Yoga might not be for everyone, or maybe it's just the type of yoga or the type of teacher. But the reason why I really like yoga is because for me it feels like meditation, and there's a lot of slow breathing, and so it's really good to stimulate your parasympathetic nervous system, your rest and digest system, and bring your nervous system back into balance so that you feel calmer, more relaxed, prevent anxiety, those kind of things. So we live in such a fast-paced world that it's really nice to complement our lifestyles with something that's a little bit slower. Yeah.
And I do like it better because I feel like it takes away that guilt because it's not you being lazy. It's like your body needs it.
Absolutely. Yeah. This is what like young girls need to know, right?
Mm-hmm.
Maybe we'll start a nonprofit or something and work with those girls, but just education.
I love that.
Yeah, I know. Nonprofit's always been on my heart, but I'm like, one day it'll come around. But just because either they learn it at home or they don't, or they learn it at school or they don't, or they learn it from their girlfriends, on like what is a cycle. I remember when my cycle started, my girlfriend said, "Oh, this happened to me last week. I was 10 years old. Like, here's a tampon. Like, let me show you how to use it." And I was like, "What?" And so it's getting better, as years go on, we are openly talking more and more about it.
Yeah.
So I foresee like 100 years from now, like younger girls will be very well aware, maybe they'll learn on TikTok. I don't know. But it's coming. Yeah.
Yeah. I was looking on TikTok to see if like there was anyone talking about it. And there's a few, but it's not huge. It's not like every fitness influencer knows about it. They're just, I work out and this is how my day went and that's
Yeah.
it. But and you'll have a few here and there that know about the phases and they'll talk about the phases, but I feel like it's very little.
Yeah.
Yeah.
Yeah. I don't know. Hopefully it'll come around more.
I feel like it will. Yeah. And then I was also learning about the foods, how different foods help throughout different phases. And seed cycling. Was that something that you
Yeah.
did? I hadn't
So-
ever heard of that.
Yeah, so seed cycling is really interesting. To be honest, it's not like part of my specialty or something that like I've trained on, to teach others. But there is a health coach that works with me, and she specializes in seed cycling. So
Okay.
I've come to find out health coaches are really great for like these pieces of education for women's health. And learning about seed cycling, learning about like fitness, like what we talked about. So if anyone is interested in, like trying to support their cycle, like even working with a health coach or like, someone to help you get started that specializes in women's health would be a good place to start. But in my theory, of what I studied in my medicine is so we look at whenever we diagnose and we treat, it's so different, and we really compare it to, the body to different elements or to different parts of nature. And so whenever we're looking at the body, whenever you're bleeding, you're losing a lot of blood. So then we connect different foods, that help to support red blood cell production or have, high amounts of like folic acid, vitamin Bs, into your diet. So when you're bleeding, you should be replenishing, with maybe like red beans, black beans, organ meats, beef, anything that's essentially like bright red in color, bloody in color, because that will help to support the blood that you've lost, So that's where like my specialty is more than seeding. But, and then of course, like when you're approaching, ovulation, eating fruits that would be more, juicy per se, like a mango, something that when you take a bite it drips, watermelon, even cucumber's really, really good.
Okay.
And then you can also kind of map your cycle out to the seasons. So kind of like what I talked about, like we connect nature a lot to our bodies whenever we're diagnosing, treating, and understanding what's going on at a root cause. And so whenever you're ovulating, it's like springtime, right? Everything's blooming, flowers are coming up. You're ovulating, your follicles are coming up. There's so many parallels to that. But, eating light salads, things that are, more fresh and bright and like multicolored, because that will really help to support you and your hormones while you're ovulating. And then that will help you develop, healthy follicles and hopefully, conceive. So, and then from there, you would go into, your summer phase, and that would be more like your preluteal, luteal phase. And then fall for sure is your luteal phase. So I know that can get really confusing
Yeah, the way whenever
going into it, but
yeah, no, when I first started learning them, I was like, how do I remember all this? And then someone said, like, the seasons.
like the seasons, yeah.
and winter, you're menstruating. I was like, that makes sense. And then spring, follicular, summer, luteal,
Yeah,
and then fall. No, sorry, ovulation, and then luteal
ovulation.
would be fall.
would be fall, yeah.
And then they explain because of how you're feeling. Like, that's
how you're feeling, yeah.
Yeah.
And so like this way to like map it out is also like the way that you map out like workouts per se, when you're looking at movement,
Yeah.
so like diet, movement based on where you are in your season and your
Right.
cycle. Yeah. So like in winter, you're more like hibernating, taking it slow, taking a rest, not really going outside, not doing a lot of movement. And so that's why they say, okay, when you're bleeding, you choose slower paced activities or meditations or yoga.
Right.
So yeah, it's a really cool way to look at the cycle and to understand it. I feel like if we have something to connect it to, then you'll remember it easier.
Yeah.
So yeah.
Yeah, I feel like that helped me. And then, yeah, I downloaded I had like 3 different period apps. I downloaded one, My Flow. I don't know if you've used
Yeah,
it.
yeah, yeah.
And it'll tell you, like, you're on your luteal phase. Slow down. Or you're in this phase. Here's, give you, like, little
Tips.
inspirational quotes, too.
Yeah.
I like that, yeah.
I love that. Yeah. I feel like being connected with your cycle's important for so many reasons,
Yeah.
just like understanding yourself a little better and then also understanding when not to get pregnant or when to get pregnant, right? There's so much to it. But whenever you understand your cycle, you're empowered to take over your health, right?
Right.
You don't fall like victim to like, oh, I got pregnant, or I don't know how this happened, because that does happen a lot. But when you understand your cycle and you track it, then okay, like this time I'm really fertile, let's like avoid intercourse or these things, so
Yeah. And, yeah, it's a lot. I feel like a lot of people don't understand that there's a difference between, because from what I read, the man, his is a 24-hour cycle. So he has his seasons in a day. And my husband was just on a podcast, and his friend, and I was telling his wife about it. So he was asking my husband, he was like, do you think it's real, the cycle syncing? Because he had never heard of it. My husband's like, no, after she explained it to me, he was like, it makes sense. Like, everything she said, like, because he knows my moods. So
Yeah.
he's like, it's 100% true.
100% true. Yeah.
Yeah.
Yeah. I think that because I study medicine that's so old, this is something that has always been. It's just coming back around.
Yeah.
It's almost like fashion. Like it was in a long time ago and now like it's in again.
Yeah.
So I absolutely. And I think that it's great because again, like it's exposing, women and men to understand like their bodies and I feel like that's kind of what this life is all about, if it's about anything, it's understanding yourself.
Yeah, I agree. So for you, you deal with people who have like fertility problems, and I was gonna ask about fibroids. Is that something that you also deal with?
Oh yeah.
I have
Yeah.
a friend who is struggling with that.
Yeah, fibroids. So specializing in women's health, mainly what I see is I see a lot of PCOS, polycystic ovarian syndrome. I see fibroids. I do see endometriosis on occasion. But majority, has really become fertility, or problem with the menstrual cycle, right? Like pain, PMS, PCOS, those things. And then menopause. I see a lot of menopause. So,
So when it comes to fibroids, do you work with them like on their diet, their movement,
yeah.
acupuncture?
Yeah, so I guess let me walk you through what it would look like so that people could understand. So when people come in, they see me, it's kind of traditional. Like they tell me what's going on. Hey, I got fibroids. And I'm like, okay, cool. And then I always ask like a million questions because it's not about treating the fibroids. It's about understanding how they got there. And so I feel like with every person I'm doing an investigation because your friend and another person that I know that has fibroids, it could be for 2 entirely different reasons, really. And so with my medicine, it's very customized, and 2 people that have the same thing might get treated completely differently. Different acupuncture points, different herbal medicine prescription, different lifestyle recommendations. So I guess that's the beauty behind it. And with fibroids, usually how we term it, like, and our terminology is a little different because it does come from China. Okay, to be fair, from China and Asia. And so we look at it as what is a fibroid? It's a mass, right? And so we say the blood is not moving like it should. We call it blood stagnation. The blood is stagnated. Qi stagnation. Qi is energy. Energy is not something per se that can always be measured, but it's the energetic force behind the blood. And so if you look at like a heart, a heart beats on its own. What is that? That's energy. It has its own electrical, stimulation within the heart that does it on its own. So we say that's chi, that's energy. So with fibroids, we say it's chi and blood stagnation. It's stagnated. So how do we get rid of that? We have to improve blood stagnation. So we do a lot of work on lower half of the body with acupuncture needles, recommending them to, go on a walk or move their lower half of the body. It is really interesting because a lot of times I've seen it also due to like trauma. And so talking about, veterans and stuff and military, I work a lot with trauma. And so understanding how trauma impacts the body, and it can impact the body in so many ways. And so sometimes it could be more of like emotional trauma, or it could be a physical trauma. And so obviously that takes time to build a good, bond with my patients before. I usually don't ever ask like, hey, have you had any trauma? I just wait until, they're ready to mention anything. If they have, they might not have. But I was actually talking with my cousin's wife yesterday, and it's funny that this came up for her because she now has fibroids too. And she got it right after the birth of her baby. And so the birth can be a physically and emotionally traumatic experience for a woman. It might not be emotional for her, but it could still be physical. You're growing a baby for 9 months, and then your body has to extract, this baby, and it can really take a toll on a woman if she doesn't know properly how to take care of herself afterwards, physically take care of herself, mentally take care of herself, emotionally, whatever. And so sometimes, these experiences that we have in our life can lead to other things in our bodies, and so fibroids could very well be something from that, from some kind of trauma. So
That's so interesting.
yeah, and then also it could be due to, diet, or, maybe not making the right choices, eating things that are, processed, not organic, those kind of, commercial foods. And her body might not be able to properly like metabolize and excrete and detox, some things that has been introduced to her body. So there's so many ways that it could have formed. And so I don't want to put a Band-Aid on fibroids. I want to figure out what caused it so that they don't come back, because it's one thing to get rid of something, but it's another thing to get rid of it and prevent it from ever coming back again.
Yeah.
So, yes, I do work with fibroids and all of these things that we talked about. And so it's so fun for me because it's always the question is why? Why? How? Like how did this happen? How did it get here?
Right.
And yeah, I have so many stories really to tell about working with women. Yeah.
And that's so interesting to me because it was recently, maybe like a couple years ago, that I learned how energy affects you physically, your emotions. And I feel like so many people don't know that.
Yes. Oh my gosh. I have a lot of people. Anxiety is on the rise. I don't know if you've dealt with it. I've definitely dealt with it, and I have a lot of loved ones, a lot of patients. And so my question of always going back is why, and looking at, all of these things that we can't see, like our phones have all this energy that's coming in and out, our computers that we're on all day. And just because you can't see it doesn't mean it doesn't exist. It does exist, and so we just might not be aware of it, we're very tech driven. There's a lot of energy that's constantly coming in and out and flowing through our bodies. And that, it might be stimulating anxiety or other things. But yeah, energy is a big one, and it is real.
Yeah. So if someone comes in and you find out it's because of trauma or energy, do you go through like a counseling session with them, or what is the next step?
Yeah. So I'm not a therapist, although sometimes it feels like I am, because I do very much care for my patients, and I will hold their hand while they cry and we're going through what's, going on.
Right.
But after I do my acupuncture or herbal medicine or whatever, my lifestyle recommendations, and they go on their way, they'll come back and see me maybe for a series of like 6 to 10 weeks. And then if they need a therapist, like if trauma does come up, I will connect them with the right resources. So we do work with a lot of, therapists that specialize in trauma, and, there's so many different types of trauma. So it's just about, it's not one size fits all. It's about like building a team of support, and so that each individual has like a team that they can rely on for whatever their needs are. And so acupuncture and integrated medicine is just, it's almost like a lifestyle thing, like how people get massages or whatever, or you get herbal medicine if you're not feeling good because you don't want, to get something from the pharmacy. So it just becomes like one of those self-care things that you do out of all the self-care things, just like we want to wake up and we want to exercise to feel good. I have people that come to me because, they feel really good with what, I can provide them.
This episode was brought to you by BCN Supplements, our all-natural supplement company. First off, we have our hydrolyzed collagen. This is a 4-in-1. It comes with vitamin C for better absorption, hyaluronic acid, and biotin. So this is good for your skin, your hair, your nails, and your joints. And this is for both men and women. Next up, we have our immunity, which is a 7-in-1 vitamin. It has vitamin C, vitamin D, zinc, echinacea, elderberry, black pepper, and garlic bulb. So this will give your immune system that extra boost. And lastly, we have our natural pre-workout. It does have 325 milligrams of natural caffeine from green tea. It is sweetened with stevia, and its purpose is energy, focus, and endurance. And for our listeners, we do have a discount code. If you visit our website, www.bcnsupps.com, you can use code BUILT, B-U-I-L-T, for 10% off. Thank you so much for listening. So you said you work on men as well?
Yeah.
That just made me think. I'll expose him a little bit, but his back is always hurting.
Yeah.
So that's something he could go and get. Okay.
I would say, so I don't specialize in men, although I love to treat men and I work with men. But the main thing that I see in a man, honestly, is for pain. It's pain. Because men are, I feel like you're brought up in a society, going back to this, I don't know, it's like a topic theme, that, trains a man to just take it, and just brush it off and take it and keep going. And so usually by the time a man will say, okay, this is too much, it's usually for pain, honestly, and back pain. And I see that, more than anything in men because, oftentimes they're doing heavy labor or, lifting a lot, the nature of, a lot of jobs, or sitting down at a desk for a lot, So yeah, it definitely does help. And I treat it a lot. Yeah.
We'll talk to you after
Yeah.
about that.
Yeah, it helps.
Yeah.
Yeah.
So going back to foods, I have a friend, and she knew that you were going to be on the podcast today, so she was very excited. She recently found out she's pregnant, and before that, she was struggling with her hormones, and the doctors had told her that she couldn't get pregnant. So then she started.
Why did they tell her she couldn't?
I don't know. She just said that she had been told that. So that's what she just thought, and that she wasn't ever going to be able to. And then, there's a book that she bought. I don't know if it's like What She Eats, something along those lines. So it talks about the different phases and what to eat during each phase. And she was like, I started doing that. She's like, and I'm pregnant.
Wow.
Yeah.
Yeah, food is medicine.
Yes.
Absolutely.
Yes.
Congratulations to her.
Yeah.
That's so exciting.
So she was telling me to ask you how does the cycles or the different phases apply to a pregnant woman, or does it even apply?
Yeah, so once you become pregnant, cycles are out the window, right? You shouldn't have a menstrual cycle until after you give birth, and eventually your cycle will return again. So pregnancy lasts for 9 months, 40 weeks, and it's broken up into different trimesters. You have your first trimester, your second trimester, which is the middle part, and then your third trimester until you give birth. So she doesn't have to worry about a cycle anymore.
Oh, that's
So
good to know.
yeah. But she will have to, be focused on what's going on in her body because pregnancy is a very fun roller coaster. Yeah. So much changes, as you're growing a baby. Usually the first trimester, she might feel nauseous, her tummy might be upset, feeling like really low energy. I've been pregnant twice. I have two babies. And I remember my first trimester, I would fall asleep on the floor. And it was weird. And I would wake up like, oh my God, like how did this happen? You just feel like someone just like turns you off like a button and you're like, yeah, you can't do anything. So, I mean, she might be, going through some of that right now. Well, that will stop at week 13. And then usually after that, it's, second trimester smooth sailing,
Okay.
energetic. She might want to work out, do some fun things. And then leading into her third trimester, week 32, 33, then that's kind of where you feel like, oh gosh, you're carrying a beach ball. You feel heavy, tired, and you just need to slow down a little bit. So, I mean, yeah, you could look at it, as far as seasons go, where at least the middle part, is your boom in spring, and then maybe like the third trimester could be summer essentially because you're so heavy, hot, sweating, tired, full, water retention galore. So yeah, that's something that she could like kind of maybe compare and map out to understand, but. And then the cycle won't return until, it really depends on the body. Once the body, feels strong enough, or whether she breastfeeds or not, there's so many factors into it. But maybe for a year she might not have one. That would be good.
Oh,
Yeah.
okay. So if someone that got pregnant or wanted to get pregnant didn't want to go through traditional Western medicine, can they use someone like you instead?
Yeah. So,
Okay.
so I specialize in fertility, and so what that looks like, it doesn't matter whether you're wanting to get pregnant naturally or if you're already considering or doing, assisted reproductive medicine, which is like IVF, IUI, where you're working with a medical doctor to help get you pregnant and help you to conceive. So it doesn't matter where you are in your fertility journey, you can work with me. I usually recommend working with my patients for 3 months before getting pregnant because it takes about 3 months for me to like regulate your cycle. So take, for example, like if you have PMS, usually for me that means there's signs that your body's out of balance. PMS is not normal. I mean, it does happen and it happens often, but it's signaling that something's, out of balance in your body, that you're having, these severe mood swings, this bloating, these cramping, whatnot. So 3 months really helps me to work with a woman on her cycle to optimize her fertility and her chances to conceive, and then also gives me time to work with a man, to help with healthy sperm, help his body to detox, help to support his testosterone, his hormones, decrease cortisol, inflammation, et cetera, in the body. So that's usually what I recommend. It doesn't always happen that way, and if it doesn't, that's okay, and if it does, great. And then from there, honestly, I work with my fertility patients once a week, and it does sound like a big commitment, and it is. It is. But it gives you the best chance to get pregnant. And I always tell my patients it's not just about getting pregnant because anyone can get pregnant, per se, most likely, right? Most people. Anyone can get pregnant. But it's about having a healthy pregnancy and a healthy baby.
Right.
Because what you don't want is to get pregnant and then have a difficult pregnancy and an unhealthy baby. So I try to, really help shift people's perspective on it's not just about getting pregnant. There's so much more to it. It's about helping you to be balanced before you bring a child into this world, mentally, emotionally, physically.
Yeah.
So what I do is I work on, all those levels of just helping you to be the best you, helping you to have the best pregnancy, and helping your baby to be the healthiest baby that it could possibly be. And then I also, while you're pregnant, I would like to talk about induction because that's always fun. So maybe we can swoop back to that. But
Okay.
while you're pregnant, I help women prepare for postpartum. So in the third trimester, usually around week 35 or so, is when we're talking about like, okay, do you have a postpartum plan? Who's going to be your support team? How are you going to take care of yourself? And so we'll schedule an appointment for postpartum, because postpartum, I have a certain technique that I do with moxibustion. It's a herb that is dried and compact that I burn, and I warm different pressure points on the body with that herb. It's called mother roasting. So you roast the mother, you warm the mother's body to help the uterus to shrink back into size, help her to stop bleeding in postpartum, and also help for milk production if she's planning to breastfeed. So I literally hold your hand from beginning to end.
Yeah.
And eventually my patients, they get pregnant, and then, I get to watch them from afar on social media with their babies. Yeah, it's beautiful, because the main thing for me, if I do my job, if I do it well, then it's that you're healthy. That's the goal, that you're healthy while you're carrying a baby. So,
And that must be so rewarding.
yeah, I have a lot of babies, and I always joke like, oh, like these are my babies too, because it just so much goes into it when you're looking at it naturally. And then if it's IVF and or other assisted reproductive medicine, acupuncture and herbal medicine is just as effective, and it's just as helpful. And if you're going through IVF, and you're having a transfer date, I still work with you once a week. And then once you're getting close to the day that you transfer, I do a specific protocol before the day before transfer, and then the day of transfer. And these acupuncture points have been researched, and researched and show that it does improve the chances of you, conceiving and your body holding the embryo. So that's kind of like how the layout goes. And then once you are pregnant, I still work with my patients every week up until week 13. And the reason is because during your first trimester, it's really easy to have a miscarriage. I don't want to say easy. It's common. It's common to have a miscarriage. You could have lower levels of progesterone, or stress, or maybe it's a chemical pregnancy. Sometimes we just don't really understand it. But what I'm working on in that first trimester is to prevent miscarriage. And so I have certain points that I do for that. And then I also have herbal medicine that helps to support progesterone. And so having low levels of progesterone is number one reason why women miscarry, So it's all about like prevention, right? So if I have a patient that says, hey, I started having spotting, and I'm kind of concerned, then I give them herbal medicine right away, or get them in with their doctor to get progesterone prescribed to them, so that we can, ensure like survival of the embryo. But there is a lot that goes on to it. But I think the main thing is that, women and men, partners, they feel supported. They feel like they have someone who listens, someone who answers questions, someone who's there, if they have any concern. And I had a patient tell me, a few weeks ago, she's like, I know you're really busy today, but I just want to tell you thank you for making me feel like I'm the only person here. And that kind of goes back to the convo that we had before we started recording about how, in the Western medicine, community, or anyone who's, dominated by insurance, and insurance policies. When I worked at the hospital at Houston Methodist in the Woodlands, I was lead practitioner there for the wellness department. And I only had 7 minutes, with my patients, And so and most medical doctors who do take insurance, you are given 7 minutes, And so it's not enough time to ask questions and get answers and do the treatment, And so I have, friends and a lot of connections with medical doctors. And so I know that they also feel like it's not enough time, and they feel pressured too. But, I guess the beauty of me having a private practice, or anyone else having a private practice, is that you have plenty of time to really work one-on-one, So when my patients come in, they're usually there for an hour at least,
Oh, okay.
So it's
That's
plenty
good.
of time, and they feel like, if anything, just like stresses alleviate off of them because they have so much support. But yeah.
And I was going to ask you about insurance for anybody listening who might be interested in coming to you. Do you take insurance?
Yeah, I did, and I don't. I did take insurance, and it just got really complicated because going back to, they have a lot of ways that you have to practice. So once you sign that contract with insurance, you agree to, to only see a patient for a certain amount of time. And the tricky thing with acupuncture is insurance have policies of when you put the needles in, you can only retain them for 15 minutes. And then if you do another 15 minutes, that's another claim. So for me, it was like, okay, like it's just so complicated, and it's interfering with my ability to give my 110% to my patients. And so I was taking it for a while, and then I just kind of stopped, which I know a lot of people like who pay for insurance, it can be frustrating. I totally understand that. And that is the hard thing about like holistic medicine or integrative medicine, is a lot of them don't take insurance. But I do work with my patients, and I have lowered my prices so that, it is like a cash pay per se, it is competitive. And I think the number one thing is that people do get care. So if like they really couldn't afford it, like I've done pro bono cases. If I have the flexibility in my schedule, I'll work with them. And if not, then I will find somewhere where for them to go. I do have a lot of other friends who practice, and me and my one of my girlfriends that I studied with, her name's Dr. Natalie Fulch. We even combined our forces, and we had community acupuncture. And so we did free acupuncture for anyone who showed up and who wanted it. And we did it one day, and we're working on another event. And the idea for me is to give back, right? Like if you can't afford it, it doesn't mean that you can't have it. I grew up very poor, so this is where like my heart, is really drawn to like giving back.
Yeah.
And so, anyways, money or not, like everyone deserves the opportunity to have acupuncture and to be able to get connected to it, just like everyone deserves to have access to medical care.
Right.
So if for whatever reason it couldn't work with me in my practice, in my private practice, like there's other options that I could link them up with, and maybe community acupuncture could be something that they might be interested in.
Okay.
Yeah.
That's good to know.
Yeah.
I don't know how to read this clock. Do we still have enough time? Or what? Where are we at?
It's 56 minutes.
56 minutes? Oh, we're doing good. Okay. So I was going to ask you the difference. So you're saying holistic medicine and integrative medicine.
Yeah.
What is the difference?
Okay. Yeah, I'm so happy you asked that, because I know that can be confusing for multiple people, because there's so many different types of terminology for that. So holistic medicine just means anything that's looking at the body on a wholesome scale, looking at the mind, body, spirit, holistic. You're looking at everything. Whole foods, everything, it's the person as a whole. Integrative medicine came about with Western medicine. So again, I'm regulated by the Texas Medical Board, and so the Texas Medical Board and majority of other medical boards, they rate Western medicine, like medical doctors, above all, right? Mm-hmm. So integrative medicine got the name of integrating holistic practices into the medical system that was already established, which would be with medical doctors. Okay. And so it's integrated. So oftentimes I will work alongside medical doctors. Or I'll tell people like, hey, go to your medical doctor, or if they've already diagnosed you with XYZ or already gave you XYZ medications, work with them, and then I will meet them halfway, and sometimes I'll get to work, very beautifully, and we'll come up with a plan together, or we'll bounce back and forth things together. So that's like integration, where two become one.
Okay.
And then another word that like was not brought up in this podcast, but I think it's fair to mention, is Eastern medicine. And Eastern medicine is what encompasses acupuncture and herbology. So when I studied, I had to study acupuncture, herbal medicine, Eastern philosophy, so like the philosophy of like diagnosis. And then I also had to study Western medicine, so I had to take 4 board exams. But Eastern medicine wasn't brought up, but I think some people will know what I do by that, so I just wanted to throw it out there that it could be like acupuncture in Eastern or acupuncture in Oriental medicine. So like that's like another branch of like what that could be categorized in.
Okay. And then you just sit with them and see what best fits each person.
Yeah. People will come to me usually, if they're just curious or they read or maybe TikTok or whatever, that they found that like acupuncture and herbal medicine could work for them. And so I get people that way. I do also get a lot of referrals by medical doctors because sometimes they can only do so much with their patients, Their patients say they have pain or they say they have this, and they're like, okay, well, I already prescribed you what I can. I don't know what else to do for you. And the patient's like, but I need this and I still have this and I don't know what to do. And they're like, okay, why don't you go see Dr. Sarah Anzola, and she can help you with acupuncture and this, because there's a lot more research now on acupuncture and what I do and the benefits and how effective it is. So I get a lot of referrals that way too. But we all try to work together, right?
Okay. I like that.
Yeah.
Before we go, is there anything else that you would like to add?
I wish I had all the time in the world.
Same. I'm like, this is so interesting.
Yeah, I think we did a good day at like covering like foundations and introductions, right, to hormones, and we were able to touch on a lot of different things that might intrigue your followers. So maybe if we do it again, we can like really deep dive into like one thing and kind of do like a continuum.
Yeah. I for sure want to have you back.
Yeah.
And then I'll get with you after too.
Yeah.
Maybe we can start working together.
Yeah, it was fun. I liked it. It was enjoyable for me. So
good. I'm glad.
Yeah.
Well, thank you so much for making the time to talk to me and my followers.
Yeah.
And teaching us something today.
Good. Yeah, I hope that y'all enjoyed it.
Thank you so much for coming on the show and talking to us. If someone is interested and they would like to follow you, how can they do so, or how do they reach out to you if they are interested in your services?
Yeah, so that's a really good question. So I'm on Instagram, and my handle is at Dr. Sarah, SARAH, Anzola, ANZOLA. And then my business, my clinic is at Templ, without the E, TEMPL Wellness. And then the website for my business is www.templwellness.com, Templ Wellness. So you don't have to live in Houston. If you live in Houston, that's great. But I'm also always open to just, hear what people have to say and try to like direct them in the best way possible if they're out of state, or try to work with them and help them.
Okay.
Yeah.
All right. Well, thank you so much. And if you guys like this episode, make sure to subscribe. We'll be sharing more wellness talks.
Thank you for tuning in to Built from the Inside Out. If you enjoyed this episode, don't keep it to yourself. Share it with someone who could benefit from it. Remember to subscribe to our podcast to stay connected. And here's a special treat for our loyal listeners. Use code BUILT at www.bcnsubs.com for a 10% discount on your next order of BCN supplements. Thank you for being part of our supportive community. We're glad you're here, and we hope you'll join us again in the next episode of Built from the Inside Out.